Good morning, everyone, and welcome to this month's ISCRR Learning Series webinar. My name is Jimmy Twin. I am the Research and Communications Translation Manager at ISCRR. Firstly, I'd like to acknowledge the people of the Kulin Nations on whose land many of us are based today. I pay respect to their elders, past and present, extend that respect to First Nations people here today. ISCRR is a unique partnership between Monash University and WorkSafe Victoria, established back in 2009. We've been lucky to work with a wonderful group of partners and stakeholders over the past 13 years and have collaborated in a variety of ways to deliver user-driven research in the area of workplace health and safety. ISCRR is comprised of three main groups. We have a research team that conducts a range of applied user-driven research, predominantly rapid research activities, including evaluations, evidence reviews, and global scans. We are also conducting some longer-term evaluations of health-based interventions. Secondly, we facilitate and broker research led by other academics and from Monash University and leaders from across the globe and drive evidence-informed policy. Our translation team, which I lead, focus on the dissemination uptake of research findings to optimize impact and increase knowledge. For those who are new to the ISCRR Learning Series, each month we present a topic on our research findings, the impact from our research, and best practice management of research. You can find out about future ISCRR events by joining our mailing list, and you can do so through the evaluation survey that will appear in your browser when you leave the session today. Today's session will be recorded and will be able to be used and viewed on ISCRR's learning channels. So on to today's session. We're very fortunate to be joined by our director, Sam Barker, who will be speaking about improving outcomes for injured workers. Sam has over 17 years of experience in the personal injury sector, 15 years of those specialising in research initiatives across government and industry. She's held a variety of key management and leadership roles in the sector and a recipient of the Monash University Vice Chancellor's Award for Exceptional Performance by Professional Staff. Sam was a founding ISCRR employee, and throughout the life of the Institute, she's played an integral role in shaping its strategic direction, research activities, and maximising the use of research into practice through innovative collaboration and co-design approaches. She has led and conducted a range of applied research projects for ISCRR's main funders, WorkSafe Victoria and the Transport Accident Commission, including the Institute's Horizon Scanning Program, which was the first of its kind in Australia to focus on compensation health. Now, I'm going to hand over to Sam Barker, and while she gets her slides set up, I'm going to open today with a bit of a poll. So in a moment, in Zoom, a pop-up window will appear, and I'd like you just to simply answer the question, do you know of someone who's experienced a workplace injury or illness? And this can include yourself. Over to you, Sam.
Thanks, Jimmy. It's great to be here today, and thanks to everyone for joining our webinar. I know we've got still a few people floating in. The purpose of the session today, as Jimmy mentioned, was to share learnings and insights about what long-term injured workers go through and how they can be better supported. I also would like to acknowledge the traditional custodians of the lands on which we're meeting today. I'm on Wurundjeri land, and pay our respects to their elders past and present. We extend that respect to Aboriginal and Torres Strait Islander peoples here with us today. So how did we go with the poll, Jimmy? Wow.
So we have 83% who said yes.
That's wow. Okay, there you go. So that is, I'm so pleased that there is such a large group. Not pleased that you've gone through the experience, but pleased that you will very much understand what we're sharing today. So many of you have that direct experience. And for those, what do we have, 16% who don't have that direct lived experience, you're obviously attending today with an interest in this area to better help these workers and integrate them into the community. Thanks so much for sharing your experience. And what I wanted to do as part of that is to share some feedback before we start from those who took the time to participate in some of our research. It's their experience, recovery, and outcomes that we are working really hard to improve, and it's important that their voice is heard. I'll just give you a moment to read those. Just for some context today, when I'm referring to long-term injured workers, that can refer to many different groups of workers. In our research, it focused on those that were 12 or more months on workers' compensation weekly income benefits. The focus today is more about what can be done to support those that are in the system for a lengthy period. There is obviously plenty that can be done to prevent workers from becoming long-term. There are modifiable factors there that can be influenced. But that really is that's a whole other presentation. So it's really about for those workers that are long-term, how can they be better supported? As most of you will know, there's been lots of focus on these claims and complex claims over the past few years, with the Ombudsman report into complex claims by Deb Glass and the recent agent model review by Peter Rosen. So there's a lot being done in this space, which is great. And really today is just a very, very what I would say, scratching the surface on some of the work that ISCRR has been involved in. Now, I don't expect you to read all the detail on this slide, but we do have attendees from all across Australia. And as many of you know, each system across each state is different. So the research we've presented today mostly relates to the Victorian workers' compensation system. So income benefits in Victoria are available until 130 weeks of incapacity. And after that time will only continue if a worker is deemed to have no work capacity. In Victoria, WorkSafe appoints agents to manage both the employer's work cover insurance, and they also manage the workers' compensation claim. From a prevalence point of view, in Victoria, there's roughly about 28,000 claims lodged with WorkSafe each year, give or take, and that's across both physical and mental injury and illness. And the impacts on workers can be devastating, and they also have a hidden flow-on effect and impacts on their family, friends, workplace, and broader community. And there's also that broader societal impact, with work-related injury and illness imposing significant costs on both the Australian healthcare system and the economy more broadly. Now, today I'm going to be drawing from a number of different studies. Most of those were done by ISCRR. One was done in collaboration with the Monash Centre for Occupational and Environmental Health, and another was led by Associate Professor Ross Isles from the Healthy Working Lives Research Group, also from Monash. And you'll notice in the session today, I'm not going to be digging into the detail. I'm really scratching the surface on the findings from these projects. And if you are interested in more detail, I'll show you at the end how to access some of our reports in our clearinghouse. And of course, happy to take any questions. I'd like to acknowledge all of the researchers listed there who conducted significant work over the past few years to inform and lead this research. So firstly, looking at what long-term injured workers are experiencing, and these findings are coming from the Victorian Injured Workers Outcomes Survey, Phase 3, which, if you saw on the previous slide, interviewed just under 700 injured workers who were at least 12 months or more on income benefits and 12 months or more since their claim was lodged. What our research showed, there were about 8% of injured workers on weekly income payments at that 1 year point. It usually alters between about 8 to 10%. And as expected, there were a number of negative health outcomes that were associated with the long-term compensable injuries. If we firstly look at return to work, 43% of those that we surveyed reported that they had returned to work. Most who found employment tended to stay within the same industry, but there seemed to be a trend of lower hours or modified duties and at times lower pay. And when we break that down by age, only just under a third of those that were aged 55 or older had returned to work, and that's compared to about half of the remaining cohort. And that's in line with other research in this area. A significant majority, just over 80%, had multiple return to work attempts, and just over a quarter, 28%, stated that they were unable to return to work at all due to their injury. They reported limited options to direct their own return to work, so that loss of control was really apparent across this group. And lastly, again, in line with a lot of research in this area and a lot of what the compensation schemes see, females certainly needed better support to return to work, especially in that middle age bracket, aligned with the extra caring responsibilities that they often have. We're going to look at mental health outcomes. These were certainly linked, or a link was noted between being on workers' compensation and the development of secondary mental health conditions for those that had started with a physical injury or illness. And having that secondary psychological condition was seen to affect attitude and recovery expectations, as well as motivation to return to work. And factors that contributed to the development of a secondary psych injury included chronic pain, disruptions to social and family life, and difficulties with the claims process. And that claims-related stress was very apparent. About 14% of those we surveyed reported that their initial claim was for a mental health injury, so it was a primary injury, and the remaining of those claims were for physical injury or illness. And just over 2/3 of workers said that they sought help from a mental health provider, such as a psychiatrist or a psychologist, whilst on workers' compensation benefits. And that again is in line with other research in this area. For those who had a physical health claim, there was a significant rise in the use of mental health services the longer that the individual was in the system. And just lastly, we used the SF12 to measure health and wellbeing in the survey. And as you would expect, those scores were slightly higher for those who self-assessed themselves as fully recovered. But I do want to note that the mental health score, mental composite score overall for the cohort was 41.6. And just to provide some context around that, a score of 42 or less may be indicative of clinical depression. So we've certainly got some significant mental health issues amongst this group. Social outcomes, again, linked to mental health outcomes, relationships were negatively impacted, including marriage breakdowns. And this notion of stigma came through consistently. This was stigma around or against injured workers. It was found especially from employers, from family, friends, and colleagues. And it was specific to those as well who had a primary mental health injury. When we go to financial outcomes, these were quite disturbing actually. There was just under 2/3 of long-term injured workers who had been 1 year since their payments ceased, reported quite high rates of financial hardship and far worse than the average population, which was around 2/3 or 37% in an equivalent financially distressed cohort. Another example of comparison is about 1 in 5 of those we surveyed reported having to go without meals, and the general population in a financially distressed cohort is around 6%. Over a quarter reported being behind on bills, and a number had also had to sell assets, and that was especially prevalent between that 18 to 35-year-old cohort. And just lastly, overall outcomes, a quarter of those we spoke to reported that they had not recovered at all. And outcomes were influenced by perceived fault of the incident or the situation that had led to the injury or illness. There's areas around perceived injustice as well, which is linked to perceived fault. And there's a lot of other research growing in this area to confirm this. Health literacy and the ability to navigate the workers' compensation and health system was also apparent. And that's health literacy to understand medical and health information being shared, what they need to do in response to the recovery, and that ability to take a driving seat in the recovery when obviously there is a host of health providers, people from the compensation system, the GP is a central point when the worker is trying to navigate such a complex system. And at the end of the claim, excuse me, those who had returned to work before that 130-week mark were slightly more positive around their experience. However, they still perceived themselves to be financially vulnerable. And this is in part linked to the fact that whilst they were in some form of new employment, this was on lesser duties or lower hours or lower pay. So they still felt slightly exposed. Most of the injured workers who left the system for reasons other than return to work, or they had reached that 130-week point, applied for benefits from government agents, most likely Centrelink government agencies, sorry. And it was common for injured workers who transitioned to those support benefits and to another system to experience significant emotional and mental distress and the financial hardship that we touched on earlier. We noted a number of challenges that workers reported in finding and keeping employment, and this included the limited ability for them to work due to their injury or illness, difficulty in finding suitable job opportunities, and that stigma that keeps coming through. And this was coming from employers, so the stigma of them being on workers' compensation, that they'd had an injury or an illness. And they found it very hard to break through to the market when this was occurring. A recent study by the Healthy Working Lives Research Group at Monash University had a look at movement between income systems across Australia. And it showed that it is quite common for people to move through multiple income support systems rather than just the one. And it also noted the distress and confusion that is experienced in transitioning from one system to the next system to the next. There's very little support that occurs at that juncture of change. Thankfully, the workers' compensation schemes have recognised the importance of helping workers through this transition period and have developed some initiatives to better support them. And there's plenty of research into life transitions beyond workers' compensation, and especially those that impact our ability to work and how best to manage them. And some of the important features around transitions is planning, support for the person going through that transition, and managing expectations. And you'll see that these are features of the initiatives that I'm going to touch on next. So the first one is a transition support intervention designed by WorkSafe Victoria, and ISCRR conducted an evaluation of this. The aim of the program was to inform workers about external services that could be used to assist them to manage their finances, their health and social needs, and to do that independently of the scheme. It included a suite of support tools that a case manager uses with the injured worker. And this included a range of conversations with the case manager, some fact sheets that would provide much needed information to the worker, including next steps in your claim, how to deal with financial hardship, how to manage money, and so on. There was also an online search tool called ISCRR to locate services based on where the worker was located and what their needs were. So, for example, things like financial counselling, housing support, and so on. It was introduced as a pilot in 2018 with just the one agent and rolled out to another 5 agents in 2019. And that one had a really strong focus on that second entitlement review, which in Victoria happens at the 70 to 80 week mark of the claim. And this includes an IME, an independent medical examination, a range of assessments with OC rehab providers, and also gathering information from the injured worker themselves and their treating healthcare practitioners. And with this information, the agents assess a worker's capacity prior to that 130-week mark to see whether their weekly benefits will continue after that 130-week stage. The evaluation aimed to understand how the initiative was being used and how it could be improved. We conducted this work over 2 phases between 2020 and 2021. We had to split it in 2 because of some delays experienced due to COVID and changes to injured workers' payments. We conducted 10 interviews with case managers and 20 interviews with the injured workers and a survey of just under 50 workers. And the overall findings were quite different between case managers and injured workers. From case managers, they reported that while the process and frequency of the communication about transition support seemed pretty standard across all of the agents, there was a huge variation in the way that case managers shared that information. In a best case scenario, some case managers tailored the information to the worker themselves and discussed the materials over the phone before emailing or posting them to the worker. But it seemed like only a few had worked in this way. They also found the materials helped to increase their confidence and improve the process of explaining the ending of income payments. Specifically, the fact sheets and the Ask Izzy platform had been well received, and case managers had little suggestions for improvement. On the flip side, injured workers, about 1 in 5, felt that their case manager had been supportive during this process. They really appreciated the active listening skills and proactive support. Some case managers informed the workers about services that were available, how to access them, as well as developing a personalised recovery and return to work plan. They said that this helped them navigate the process and helped their recovery. Unfortunately, the majority of workers, about 80%, did not feel supported during this stage, and they identified a lack of continuity with their case manager and communication as that primary reason. They talked about having to retell the injury event and the case history, and that re-traumatised them and had a detrimental effect on their recovery. And this is a common theme. So this is not just specific to this intervention. And we suspect that whilst that may not have occurred during the intervention itself, the worker has been so used to changing of case managers and having to retell their story that that's clouded their perception of the intervention. And importantly, this disengagement influenced their ability to receive and uptake the written materials. And really, they reported that they did not feel prepared for when their payments ceased. The great thing for us about working with WorkSafe is that they are quick to act on research evidence and insights to inform their decision-making and the services that they offer to injured workers. So they've done quite a bit with the findings and learnings since this work was done. And they have made a number of updates to the initiative to strengthen support. And that, for example, includes training for case managers across all agents in what the best practice approach is to utilising these tools, amongst other areas. The next project that I'm sharing with you is also around this transition stage, but it was done a little bit differently. The research was led by Associate Professor Ross Isles from the Healthy Working Lives Research Group at Monash University. Now, this pilot was a key project of the collaborative partnership led by EML. And for those who don't know this national alliance, it's between public, private and non-for-profit organisations. And it was established to improve work participation for Australians who have a temporary or permanent disability, physical health condition or mental health condition. And it's to help them participate in good work. The project was designed and trialled a transition support service for people that were leaving the workers' compensation scheme to another system of income support. And that could include life insurance, superannuation or social security. And the project actually built on another key project that the partnership facilitated. And it was the earlier findings from what was called the cross-sector research project. And this found that people are most vulnerable as they transition between systems, and no system currently provides that support at that critical time. And that was in line with the findings that we found from the Victorian Injured Workers Outcomes Survey. So EML developed and delivered this pilot 12 for 12 months for injured workers that were reaching the end of their benefits in Victoria. It tested the delivery of the program to support individuals who are identified as approaching a transition out of the scheme. And the aim of the pilot was to identify those opportunities to improve work participation, general health outcomes, and that overall transition experience of those who were transitioning out or between income systems. And it was really about providing a tailored transition support service. And this was done through a transition specialist who was a qualified care professional, such as a social worker, and they applied a client-centred approach to identify the immediate and ongoing needs of the workers who were approaching that time point of leaving the system. And the specialist, over a period of about 6 to 8 weeks, communicated regularly with the worker to deliver a really tailored support and facilitate a range of services from rehab counselling, connection with community supports, and helping them plan for future employment. The pilot went live late 2020 in August and ran for 1 year. And it was long-term injured workers who took part who had been off the scheme for 3 or more years with some work capacity but no return to work. There were a number of findings and insights developed from this program. Timing was key, and this differed depending on an individual's circumstances, which makes it tricky because obviously then that tailoring of support is quite critical and it differs amongst their workers. Like our study, there was a large proportion of workers who experienced financial hardship, and some participants were keen to have financial counselling. Whilst this wasn't a feature of the program, since doing this research, financial referral channels are now being investigated. Workers saw that the strong empathetic service was seen as positive, and there were participants who really wanted to work. At least half reported that they were unable to. Some reported the unsuccessful employment support interactions, including inappropriate roles being recommended to them, and almost a superficial focus on resume writing. The participants involved in the trial gave a range of suggestions for improvement. There were lots there. And some felt that they required improved guidance and information, although it must be noted that about 80% of the participants agreed that the specialist considered their individual circumstances. So it's certainly coming through that tailoring was occurring really, really well and personalised service, but there's still a bit of a gap for a bit more information and guidance. There was another suggestion from the trial to provide practical support in finding employment. And the transition support program differentiates between employment outcomes and work readiness. And the latter was more of a realistic outcome for the participants that took part in the program. And where employment had been identified as a realistic outcome, the transition specialist can now directly refer the worker to a tailored employment support opportunity. So overall, this intervention was highly successful, and a number of revisions are being made, and it's continuing to this day. The next area I'm focusing on is social prescribing. This approach, which I'm sure many of you are familiar with, helps health professionals to refer people to a range of non-clinical services that can help address the social determinants that lead to poor health, loneliness, and social isolation. Instead of prescribing medication, social activities in groups and services and supports are prescribed. And this has been well practiced in the UK NHS for many years, as far back as the early 90s, to reduce loneliness and empower people to really take greater control of their health. And there's also been successful trials in Canada and Singapore more recently. It's a person-centred approach and supports individuals with a range of complex physical and mental health needs. Now, there's a number of benefits around social prescribing, and it's got the ability to address a number of underlying issues that lead to negative outcomes. And that includes areas around social connectedness, mental and emotional well-being and quality of life, And that's through reductions in the social isolation and loneliness, mental health levels, but also the use of healthcare services, so around hospital admissions, visits to the GP and so on. So this has got a lot of potential for the long-term injured worker group. Now, there's one example of an initiative of how this has been trialled with injured workers. There was a partnership recently between Happy Paws, Happy Hearts, which is a national initiative to support people who want to connect more with the community, RSPCA New South Wales and the iCare Foundation. And they brought injured workers into local animal shelters to work with animals by caring for and training them before they were ready for adoption. And specifically for this program, the Happy Paws, Happy Hearts initiative supported medically retired police officers from the New South Wales Police Force and people that had experienced post-traumatic stress disorder symptoms and who were injured or medically retired. So that was the cohort they were focusing on. The program ran for 12 weeks in person and online because this was all occurring during the COVID pandemic. And there were a number of positive reinforcements to keep people motivated. It actually turned out that the online sessions were quite valuable because some of these workers were unfortunately experiencing some levels of social phobias and inability to leave the home. So that preparation to get ready to go and visit the animal shelters enabled them to prepare for that. There was an evaluation conducted by Social Outcomes Australia, and the findings from that noted the following. So there was evidence generated by the pilot and existing evidence in the sector for what works for this cohort, and that is around a trauma-informed approach. And Happy Paws, Happy Hearts takes that approach. So they do that by improving wellbeing through animal therapy interventions, addressing the social determinants of health, and facilitating future resilience. And Social Outcomes concluded that with confidence, the pilot in practice had reflected this evidence-based approach. Social Outcomes also came up with the term the gateway effect to describe the effect when people experiencing complex social isolation engage in a program, in an initial program, that then re-engages them into the community. And that leads to broader outcomes as well as greater engagement with other programs, services and support. And they concluded that Happy Paws, Happy Hearts pilot had been able to demonstrate this effectiveness by providing a process for this gateway effect. So it's almost the first door that opens for these workers who have experienced significant distress and issues since they incurred their injury and illness. And it's enabled them to start the process of reintegrating back into the community. There was also a significant amount of anecdotal feedback from the workers and those involved in the program, which was extremely positive. The impact on their lives of the workers who took part was significant. And in talking with the group that ran this program, they told me about one worker who had developed a social phobia, and they were able to work with this worker over many weeks to build up that ability and strength to leave the home and to be able to partake in the program. And they were pleased to say that that worker did take part in the program and concluded it to the very end. Now, social prescribing has gained attention in Australia in recent years as an innovative option to support those with mental health illnesses and issues. And the federal government's 10-year primary healthcare plan, which was released earlier this year, does include the development and implementation of evidence-based models of social prescribing. And this is in part thanks to the Royal College of GPs, the Consumers Health Forum and Mental Health Australia, who advocated for this to be included in the plan. So there's certainly going to be more happening in this space and is an area to watch. This is also an area that ISCRR will be looking at conducting evaluations on. Options for supporting long-term injured workers. Just on here brings together insights from most of the projects that I've shown earlier and were the major suggestions from injured workers to improve the work cover experience. Throughout our research and stakeholder discussions, the same issues and options came up. So many of these same factors come through. This includes obviously the transition support interventions that we've spoken about, the use of telehealth, which thankfully is continuing in certain areas post the COVID pandemic. There's a number of insurers that have the opportunity to assist employers with the return to work process for those that do require additional support. And voluntary work and training is most certainly a return to work pathway with no loss of entitlements. And this is something that WorkSafe Victoria have been trialling at the moment with a volunteering program with Parks Victoria. There's opportunities to promote recovery and improve outcomes. Screening and segmentation of high risk and vulnerable workers is something that all workers' compensation schemes are trying to tackle, and there are many different ways that this can be done. Access to early treatment. WorkSafe Victoria, as many of you know, recently updated legislation for provisional payments for those who need to access mental health services before their claim has been reviewed and approved. So this is allowing people to access those mental health services immediately for that early treatment. Case conferencing as part of vocational rehab has been found to improve communication and coordination between workers and other stakeholders. And this was an evaluation that we conducted about 2 years ago for WorkSafe Victoria. And just finally, case management is obviously a significant focus. This area around being person-centred, client-centred, having them at the centre of treatment and service, that compassionate response coming from empathy and understanding what the worker is going through. And importantly, there is the need to ensure that the caseworker, transition specialist, whoever it is that is working with the worker, has the support required to do their role without risking their own health and wellbeing as well. And we're looking currently into areas around vicarious trauma in a number of different occupations, and claims managers is one of them. We've got a number of new research informing new initiatives. So around system support, we're evaluating a pain education program that WorkSafe have recently implemented, which is supporting not just long-term injured workers, but those who have complex needs and helping them. It's really taking that person-centred approach to understand what pain they're experiencing, how they're managing their pain, and tools to assist them with that. And early insights are showing that has been very, very successful. There was a clinical review hotline that we recently evaluated, again for WorkSafe Victoria, and that was really about practitioners in the community having access in real time to clinicians on the clinical panel. And the feedback again from this was extremely positive. Clinicians were taking the time to provide advice, bounce off ideas, and this is something that is looking to continue. Person-centred case management I touched on earlier and is a strong focus across the system. Areas in social support, we're just recently handing in a draft report around the use of assistance dogs for therapeutic support for those with PTSD and looking at the evidence for that. And we're also looking at the evidence around volunteering programs, and we'll soon be developing a program to trial a social prescribing intervention in Victoria. And just lastly, clinical treatments, whilst when you get further down the line can be a little bit tricky, we've done a number of reviews around treatments of relevance to those with complex injuries and long-term needs. And that includes the effectiveness of lumbar spinal fusion surgery, medicinal cannabis for pain, ketamine for depression, and spinal cord stimulators. The research from those clinical effectiveness reviews is available on our clearinghouse, which I'll show in a moment. So in summary, it's hard to summarise all of this information, and I really just have skimmed the surface. But as you would know, it's a long and difficult journey for many, many injured workers and their families. And they experience a range of negative outcomes that are associated with being on the scheme for so long. And this continues after they leave the compensation system. Complex claims, or those with complex needs, are a strong focus at the moment. As I mentioned at the start, there is the Ombudsman report that came out. There's been the agent service model review, and WorkSafe Victoria have insourced a number of complex claims, which is a significant initiative, and they're taking a really strong worker-centric approach as part of that. And there is support for longer-term injured workers with a much more tailored and intensive approach. And that focus on engaging with the community and providing them with a sense of purpose is really, really important. If they're not able to return to work, there is a range of other ways that they can contribute to their community and help them see that they do have a role to play. If you're interested in more detail, reports for most of the research that I've spoken about today are available on our clearinghouse. And if you go into the search column, which is there on the top right, and type in long-term injured workers, there's a range of reports and summaries that will come up. Happy to take any questions. I'll do my best to answer if they've come through. And I really thank you for your time and for listening today.
Thank you, Sam, for a great overview and showing why long-term injured workers need the support that they need. We've had quite a few questions come through today. It's not too late to get your questions in. We only have time to address a few of them now. So please put them in the either Q&A function in Zoom or in the chat function. Mention everyone in case there are other experts who can also add to that conversation. If you have any particular questions that you want us to talk with you further, please feel free to leave your contact details in the survey that'll appear when you leave, and we'll get in touch with you as soon as possible. So with the first question that's come through, that what is being done to improve the transition support process?
Yes, I only touched on a few of the initiatives. So I talked about training for case managers around timing of delivering those materials and best practice. Also around tailoring the choice of materials to injured workers. They've done a number of refinements to the documents. So they've translated the documents into a number of other languages. And they've, I guess, created more specific information for people such as those nearing retirement age. Because there was a little bit of feedback that some of the information was a bit too generic and, again, just scratched the surface. They've also had a much stronger focus on explaining that second entitlement review, which is a really complex process for not just workers, for anyone to understand. There's a number of different steps in the process, and it does take quite a long time and can be really stressful for workers when they go through that. They've also rolled out the program, as I understand it, to anyone that is ending their income weekly benefits. So it may be that after 6 months, someone is deemed to have capacity to work. So this transition support service is also being shared with those who need that additional support as they finish up on those weekly income benefits. There may be a number of other enhancements that they've done since that time. This is obviously just what they've shared with ISCRR, but it really, the improvements are going to make a huge difference in response to the feedback received. And coupled with that insourcing of case management that WorkSafe has been doing and really focusing on that person-centred approach, we really look forward to doing another evaluation to see how things have improved.
Thanks for that, Sam. Next question is, and this may differ in different areas, but how many long-term injured workers actually return to work?
Well, what we found in our survey and the claims administration data is that about the 12-month point, about 8 to 10% of workers at 12 months are still not working. Of the group that we researched through the Victorian Injured Workers Outcomes Survey, 43% achieved a successful return to work by the time they were off benefits. But certainly, as you would expect, the longer they're off work, the lower the return to work rate. And that's why there's that really strong need to provide a more social focus on how we can integrate them into the community and provide them with that sense of purpose. It becomes less about being able to work and more about that work readiness that the study led by the collaboration partnership focused on.
Thanks, Sam. And so next question, that you mentioned that people who are long-term injured are at a detriment financially. How does that compare to the general Australian population?
Yeah, I think I touched on this earlier on. It's quite confronting when you see how it does compare to the general population. If I use the example of who has gone without a meal in the last 12 months, the ABS data, if you look at all households, was around 3 to 5%, whereas it was much higher, as I said, for injured workers. And even for those 12 months post-payment ceasing, it was around 15 to 25%, which is a significant difference. Even when you look at financial hardship overall, the rate was about 68%, I think I mentioned, for injured workers. And the general population, a cohort of people who are financially distressed, was 37%. So this group have significant financial hardship, and that can be for a variety of reasons, but certainly because of navigating those income support systems and noting that when they leave workers' compensation, the workers' compensation income benefits are far more than what they get when they move across to Centrelink, disability support, pension, and so on. So they really are struggling financially. And there's an element of social responsibility to really support these workers in their journey through workers' compensation and into the next system.
Thanks, Sam. And a final question, just looking at time. So we'll be closing the session off in about 5 minutes' time. And I'll attempt to combine two questions here. And it's a little bit of a leading into our next learning series session. There was a question that came through asking if there's questions on identifying red flags within the first few months of a claim, which predicts whether someone will become long-term, and are there activities more likely to become a long-term claim. Edith in the chat mentioned the musculoskeletal pain questionnaire, which ISCRR has done a bit of a screen for that and found out that it's used by many Australian insurers to determine the risk of delayed return to work following soft tissue injuries. Sam, would you like to comment if there are any activities more likely to become a long-term claim?
Yeah, look, I mean, there's so much research in this space, and there's so much work that the workers' compensation schemes and the insurers have done with statistical modelling and using validated tools to understand, what are those red flags. And one of the key things is it's not always injury, as many of you will know. It's often what the psychosocial situation is for the worker, what their situation is with their employer, whether they have a good relationship with their employer, whether they have a supportive manager, even what their own personality is and their own level of dealing with stress. If they're already stressed, having mental health difficulties because of personal things going on in their life, and then they experience a workplace injury, sometimes it can be the straw that breaks the camel's back, and they're a person that needs additional support to navigate the system. I can certainly ensure that we can share some papers. There's some published papers around this that we can share with those who attended afterwards, which can provide more specific information on those red flags. But again, it needs to be done at regular time points. It can be done at the start of a claim, around social support and income, the type of industry that they're working in, their age, whether they have dependent children. All of these more psychosocial questions are so important at the start. But it's also about checking in throughout the life of the claim. It might be that someone is travelling really well. By the 6-month point, they start to experience difficulties, and it's that regular checking in, screening again for complexity, rather just assuming that at that 3-month point, that's how the claim will stay. But if we can take that as an action, Jimmy, to share a couple of those papers with the group, that would be great.
Certainly will. And thank you, Sam, so much for your talk today. And thank you for everybody. We had great attendance today. So we're very, very thrilled that we're part of the conversation and you're listening to the great work that's being done to support injured workers. And there's a lot to be done still in the future.